All right, so we have our lovely subjects here, Charlie and Ellis. This part of the exam, it's going to involve two special tests. So it's going to involve the prone instability test as well as the passive lumbar extension test. The subjective portion of the exam has already been done, and the beginning of the objective exam has already been completed. So palpation, reflexes, all that good stuff has already been completed. So now we've hypothesized that the patient does have, or suspected to have, lumbar instability. So what we're going to be doing now, we're going to go through the first test. It's going to be the passive lumbar instability test. I'm going to have Ellis lay down on the table. Prone. Yep. And what we're going to do here, I'm going to lift her legs up just slightly, and then I'm going to pull. I have like an axial distraction here. And what that's going to do, is that creating any symptoms though? Yeah.
Yeah.
So basically what that's doing, it's separating the facets, and what we're looking for here is if her back feels like it's being pulled apart, obviously with any recreating of symptoms, it's going to be a positive test. So the next test we got is the prone instability test. So I'm going to have Elle go to the edge of the table here with her toes hanging off of the table, obviously, and onto the ground, just slightly touching. And then what I'm going to have her do, I'm going to first palpate her segments here. So we're looking for L5 on S1, so we're going to look pretty low in the lumbar spine. So I'm going to palpate PSISs, and then I have L4 right here and L5. And this should be painful right here as I palpate and add just a P to A. And what I'm going to do, I'm just going to go up the spine just for good measure. And obviously the patient would be saying, if lumbar instability was present, there was a spondy present, she would be indicating to me that L5S1 would be a painful segment. So what I'm going to have her do, I'm going to ask if that's painful. Is that painful?
Yeah.
Good. Okay, and then what I'm going to have her do, I'm going to have her actively extend her legs, so lift your toes just slightly off the ground. Good. And I'm going to palpate again. And then once I palpate, I'll ask if that's painful.
No.
Good. You can relax. All right. That was the passive lumbar extension test as well as the prone instability test.